Hey, my name is Megan Bell, and I'm an occupational therapy assistant student. And today we are going to be doing lower extremity palpations. The first muscle that we are going to look at today is the rectus femoris. It is one of the quadricep muscles that is on the anterior surface of the thigh. It crosses over two joints, which is the hip joint and the knee joint. It originates at the anterior inferior iliac spine and runs all the way down to the patella. Now, first to find where it originates, we have to find the anterior superior iliac spine, which is this prominent part on the hip right here that sticks out. From the ASIS, we run inferiorly and then medially, and we feel deep right there, and that's the origination of the rectus femoris. I can ask my client to straighten their knee out and leg and lift their whole leg up to the ceiling. And right here at the AIIS, I can feel it originate. From this tendinous portion, I can follow it inferiorly where it starts to become a muscular belly right here. And I can really get my hands on the muscle fibers and rub my fingers over it. From here, it becomes more tendinous down to the patellar tendon right here, which is where all the other quadricep muscles come and meet right here on the patellar tendon, and get you to relax. The patellar tendon encases the patella and it crosses the knee joint and inserts right here at the tibial tuberosity, and that is the insertion of the rectus femoris. The next muscle that we're going to palpate is the gluteus maximus, which is the large, thick, one joint quadrilateral muscle that is located on the superficial aspect of the posterior buttock. And the general area that it originates is the sacrum and the ilium, and then it goes and runs distally down to the gluteal tuberosity, which is located inferior to the greater trochanter. And I can locate this muscle by asking my client to extend their hip. So I'm going to get you to take your whole leg and raise it up to the ceiling for me. And all of this right here is the gluteus maximus, and I'll get you to relax. There is a superficial layer of adipose tissue that is on top of the gluteus maximus, and the gluteals are deep to this superficial adipose tissue. Now, first we are going to try to find some bony landmarks that are going to help us isolate the gluteus maximus. The first of these is the PSIS, which is also known as the posterior superior iliac spine, which is the dimples that are located on the lower back. So I'm going to find the PSIS, which is right here. And then I'm going to walk my fingers down over the sacrum, all the way down to the coccyx right here. Now, this ridge that goes from the coccyx to the sacrum to the PSIS and the posterior iliac crest, this is the border of one of the gluteal muscles, or the gluteus maximus muscles. So the origination of the gluteus maximus is this sacral and ilium area right here. And the gluteus maximus goes down to insert at the gluteal tuberosity. Now, this is just a general region and it's not very easy to palpate. So in order to locate that, we first need to find the greater trochanter of the femur, which is the knob of the hip. And in order to do that, I can passively laterally rotate and medially rotate the hip. So I'm going to rotate it, and I can feel the greater trochanter move underneath my fingers right here. So once I've located the greater trochanter, all I'm going to do is move distally, and this general area right here is where the gluteal tuberosity is, which is the insertion of the gluteus maximus. I'm going to ask my client to engage the gluteus maximus again by lifting their leg up to the ceiling, and I can feel where it inserts right here at the gluteal tuberosity, the gluteus maximus. Okay, you can relax. And the action for the gluteus maximus is hyperextension of the hip, hip extension and lateral rotation. Alright, and the last muscle that we're going to palpate today is the gastrocnemius muscle, and it crosses over two different joints, which is the knee joint and the ankle joint. And it has two heads. It has a lateral head and a medial head. And to engage this muscle, I'm going to get my client to do ankle plantar flexion, so please come up on your toes. And here you can distinctly see the gastrocnemius muscle right here. And this is the lateral head, and then this is the medial head. The origin of the gastrocnemius is the posterior surface of the medial and lateral condyles of the femur. You can relax. The origin goes down on the posterior surface of the leg and forms down here at the Achilles tendon. And the insertion of the gastrocnemius is the posterior calcaneus. So it runs from the origin at the lateral and medial condyles of the femur down to the Achilles tendon, and it inserts at the posterior calcaneus. Okay. And we can also find this muscle if I ask my clients to lay prone on the table. So please lay with your stomach on your stomach. All right. And I'm going to put my hand in the middle of the foot, and I'm going to ask you to point your toes towards this way, okay? And once she does that, I can clearly see the gastrocnemius from this portion. And here again is the medial head of the gastrocnemius and the lateral head. And I can, if you ever lose your point of reference, you can divide the leg into half. And right here at the bottom are the gastroc heads. And you can follow these muscle bellies up to the knee. Next, I'm going to ask my client to bring their heel towards their head, and I'm going to resist. So, okay. And when she does this, we can see the hamstring tendons pop out right here. And the gastroc heads, they go in between these two hamstring tendons and disappear where they attach at the medial and lateral condyles of the femur. Okay, relax. Thank you. And the action of the gastrocnemius muscle is knee flexion and ankle plantar flexion.